Here's a shocking reality. Nearly half of preschoolers diagnosed with ADHD are being prescribed powerful stimulant medications before even trying the therapy that experts say should come first. This isn't just a statistical anomaly. It's a systemic issue in how we're approaching childhood mental health. Let's break it down. According to a recent study published in JAMA Network Open, researchers led by Stanford University's Bennett discovered that 42.2% of children aged 3 to 5 were put on stimulant drugs before evidence-based behavioral therapy could be attempted. Clinical guidelines clearly state that for this age group, therapy should always be the starting point. Medications are supposed to be a second-line option, reserved only for cases where therapy hasn't worked, or when symptoms are so severe they're causing significant dysfunction. But here's where it gets controversial. More than a third of these young patients didn't even get enough time with behavioral interventions to determine if they'd help. Why is this happening? Is it a lack of awareness among doctors, or are parents and providers prioritizing quick fixes over long-term solutions? The study's authors highlight a critical gap. When therapy is rushed or skipped entirely, we risk over-medicating children whose challenges might be better addressed through parenting strategies, classroom adjustments, or early childhood behavioral programs. And this is the part most people miss. Stimulant medications, while effective for some, aren't a one-size-fits-all answer for preschoolers. Their brains are still developing, and the long-term effects of early medication use remain poorly understood. Should we be pushing pills for a 4-year-old before exploring non-pharmaceutical options? Or is there a middle ground where therapy and medication can work hand in hand? The debate isn't just academic. Millions of families are navigating these decisions daily. If you've ever wondered whether ADHD treatment for young children is being handled responsibly, this study raises urgent questions. And if you're curious to dive deeper into the full analysis, you'll need to support MAD in America's mission to uncover these truths by becoming a MIA supporter. You gain access to all their investigative reporting and events, because understanding the complexities of mental health shouldn't come with a paywall. If financial barriers exist, reach out to them directly. They promise to ensure no one is left behind. What's your take? Is this a case of over-medication? Or are there situations where early stimulant use is justified? Share your thoughts below, and let's keep the conversation going.